Picking up with part 3 of chapter 9, we're moving out of the physical methods into some chemical methods of microbial control. There are a lot of different chemicals that are used to control microbes. They're grouped into broad categories: high, low, or intermediate effectiveness of microbial control. We'll talk about the advantages and drawbacks of each type of product. The effectiveness is going to vary with the condition. And sometimes some of the chemicals would be more effective against a specific type of organism that you're most concerned with. You need to be familiar with what the proper application, because not all chemicals are appropriate for specific applications. The first, and I suppose the classic type of chemical method of control, uses phenol and phenolics. Think back to our historical figures, Semmelweis and Lister. This is the type of disinfectant they were using. These are the intermediate or potentially low-level disinfectants. At the bottom of the slide are some examples of chemical structure of these agents. They're pretty stable and stay active even when there's organic matter present. This characteristic makes them useful in certain medical or laboratory situations. Triclosan, the one that's shown on the bottom right, is interesting. It used to be included in very many different commercial products. You could find it in toothpaste and baby toys and underwear. Everything was labeled antibacterial and had triclosan included as an ingredient. But there was a lot of outcry from scientists and concerned, informed consumers. People were very concerned. Microbiologists and scientists were concerned that this antimicrobial was being included in so many things, and it might just select for resistant strains without providing a benefit to society. It had not been shown to be of great benefit by being included. It was a marketing ploy. Marketers were getting people excited about killing germs and were putting disinfectants in everything, including things that did not need to have disinfectants. Why did your underwear need this exactly? Eventually, the FDA stepped in and required that this ingredient was, if it was to be included, it had to have studies, have evidence to support the benefit of inclusion. One drawback to phenol itself is that it can have a disagreeable smell. Most people, they don't really like the smell of these particular agents, and the smell prevents these agents from being used more widely. Alcohols are used quite frequently as a disinfectant. Think about when you enter the microlab or in a doctor's office. Alcohols are an intermediate level disinfectant. They are the active ingredient in hand sanitizing gel. They're used to wipe skin before an injection. The disadvantage for these is that they can evaporate really rapidly. This can be a problem if they evaporate before they exert their effect. However, evaporating rapidly could be a good thing when you want to have the effect and then disappear. These don't usually have a smell that lingers that people find unpleasant. Alcohols are intermediate, and they do have a lot of use, especially on skin surfaces as an antiseptic and on surfaces like in a lab setting. Halogens are also intermediate. Examples of halogens include chlorine bleach that is used in so many different settings, and the iodine you use for disinfecting skin prior to some sort of medical procedure. The betadine type solutions, iodine, is also used widely as an antiseptic. Halogens do have a disadvantage in that when there is a lot of organic material, then they can be inactivated. Think about the public pool situation. If there's a lot of people, a lot of individuals that go into the pool, they're all shedding skin cells and lotions into the water, and the level might get too high and can inactivate the chlorine. It won't be effective. The folks in charge of the pool have to monitor the active chlorine and adjust to make sure that you have a proper level to achieve disinfection. Oxidizing agents are next. Remember, oxidation is loss of electrons and hydrogens. So oxidizing agents are going to pull the electrons and hydrogens away from key molecules. One of the great examples of oxidizing agents that is used in microbial control is hydrogen peroxide. While it's a really good oxidative oxidizer, it's not actually really useful for treating open wounds, despite the fact that's what your mom may have done for you growing up. People pour it on a wound and see the bubbles and think that it's working. It's actually oxidizing your own skin cells in the open wound, and that's not so great. We'll talk about the enzyme that our tissue has that's inactivating the hydrogen peroxide, producing bubbles in lab. Now that you know, you should avoid using hydrogen peroxide on open wounds from now on. It is used in other scenarios and can be quite effective. Ozone is another effective oxidizing agent. The image on the bottom right depicts the chemical ozone. 3 oxygen atoms bonded together. Ozone is effective and used in some industrial settings. It is damaging to lung tissue, so it must be used in controlled situations. Pure acetic acid is another oxidizing agent that's used in industrial settings. It's used especially to sterilize equipment. These are important oxidizing agents, and they can be quite effective in greatly reducing microbial numbers. Surfactants are the next chemical agent to discuss. Surfactants lift particles up off surfaces. They are the important component of soaps and detergents. When coupled with degerming activity, which is the physical or mechanical removal like scrubbing, they can be quite effective at reducing the microbial population. At the bottom of the slide, you will see the quaternary ammonium compounds. These are often used in medical and industrial applications. They're low-level disinfectants, but they can be quite useful because they have no taste. They don't add color to anything, and they're harmless to people. They do have antimicrobial activity, so if you're using them in an industrial kitchen setting, for example, if there's residues left behind after you use the agents, you don't have to worry. It's not going to cause a problem for people that perhaps ingest some of it. Quaternary ammonium compounds are used quite often in places where food is served. So if you're working somewhere that uses disinfectants, you might want to take a look and find the active ingredient, and you might be using a quat. Heavy metals are another important method of microbial control. They're a low-level disinfectant. They tend to prevent multiplication rather than kill organisms. There are 3 examples that are listed here. The first is silver nitrate, which used to be something that was included in eye drops that were given to newborn babies. These drops could prevent Neisseria gonorrhea, which causes gonorrhea, from infecting the infant's eye. The infant could pick up the bacteria during the birthing process if the mom was carrying or was infected with the bacteria, and it can lead to blindness. This was the treatment to prevent that. It has since been replaced by other antimicrobial agents. You do find silver nitrate in some products. For example, in medical pads that are placed around an inserted needle, like into a patient with a port, the needle may remain for several days. These pads sometimes have silver nitrate embedded to prevent a biofilm from forming on the inserted needle. This is to protect the patient from infection. Thimerosal is a mercury-containing compound. It's included in a few vaccines, but not vaccines for children. This compound was the basis of a lot of controversy surrounding vaccines. The concern was especially great for childhood vaccines. While there was not scientific evidence to support the concern, out of an abundance of caution, vaccine manufacturers removed this preservative from childhood vaccines, but it is still included in a few adult vaccines. Thimerosal is included in very low quantities, not enough to actually be toxic, but because of the controversy and the concern for children, it has been removed. Mercury, of course, is toxic in high enough dose, but dose is important. Everything, including water, is toxic if a threshold is exceeded. The dose makes the toxin. Thimerosal is included in much below the toxic dose as a preservative in some adult vaccines. Copper is another heavy metal with some applications. If you've ever been to a park pond and the pond has this unusual blue hue to it, or if you have a fish tank, you might be adding copper-containing product to it to control algae. The blue solution contains copper as the active ingredient. Copper interferes with the effect of chlorophyll, and that prevents photosynthesis, and therefore algae will die. Of course, in too high a concentration, you'll end up killing fish and other living things. You have to be careful about how you add your solution to the water. Aldehydes are another important chemical method of control. You might be familiar with formalin, since formalin is used in the preserving of animals and parts that are used in the anatomy labs for dissection. That smell that you might be familiar with is formalin. It's used in disinfection as well, but it's often used in embalming to prevent degradation of the tissue. Glutaraldehyde is an important method of disinfection. Interestingly, glutaraldehyde can be used for a short duration of application as a disinfectant. However, if you expose something like medical instruments to glutaraldehyde for long periods of time, you can actually sterilize the instrument. Both glutaraldehyde and formalin are important chemical methods of control used in medical and teaching laboratory settings. This next agent is the only gaseous agent. Ethylene oxide and sometimes propylene oxide, but ethylene oxide more often, is used to sterilize items. This can be effectively used for items that have a lot of nooks and crannies because the gas can penetrate into those spaces. You would not have to worry about heat ruining the structure either. It's a hazardous gas, so it has to be used in very controlled settings. In the photo, you can see the chamber. This individual is placing some laboratory garments into the chamber to be sterilized with the ethylene oxide. It can also be used for equipment, like satellite components. There is a huge concern regarding accidentally introducing life onto other planets. So, if we're sending rovers up to land on Mars, we don't want to send any microbial organisms with the rover to deposit on the planet. The rovers need to be sterile when they go up, so ethylene oxide is used in the correct enclosed chamber. This gas can be used to sterilize any kind of equipment, even something as complex as part of a satellite or a rover. Enzymes are sometimes used for microbial control. There's really just two examples we'll discuss. The first is lysozyme, which is a natural enzyme found in our tears and other secretions. Lysozyme breaks apart peptidoglycan. It breaks down the cell walls of bacteria. When cheese is being manufactured, at a particular point in the fermentation of the products to make cheese, lysozyme is added to knock down the microbial population. The goal is to slow the fermentation to prevent it from regressing too far and alter the desired cheese flavor. Lysozyme is used in cheese production. Interestingly, the lysozyme itself is manufactured by genetically engineered bacteria. These bacteria produce large amounts of lysozyme so it can be easily purified and used in the industrial settings. The second disinfecting enzyme is used is an enzyme that specifically targets prions, the infectious protein. Prionzyme is an enzyme that can be used to denature or break down prions, which are naturally extremely resistant to degradation. Remember the figure that had the resistance level from the most resistant on down? Prions are the most resistant. They are extremely stable and difficult to denature. However, there have been enzymes that are known to degrade prions. One was on the market for some time. I haven't seen it recently. It might still be used in some settings. These enzymes are used to degrade and inactivate prions on something that might be used again, like medical instruments. We're going to go into antimicrobials in detail in chapter 10, but for an introduction, we'll talk about them here in this chapter because, of course, antimicrobials are used to control microorganisms. The term antimicrobial is the umbrella term. It's the overarching term that encompasses everything underneath it. For example, an antibiotic is an antimicrobial. Antibiotic actually has a very specific definition in microbiology, even though in everyday speak, it's used more loosely. When we're talking about an antibiotic in micro, we are specifying that a chemical is produced by one microbe to inhibit another type of microbe. This is the true meaning of antibiotic. If you think of penicillin, It's a chemical substance made by a fungus, and it inhibits some bacteria. Penicillin is truly an antibiotic. A semi-synthetic antimicrobial is something that started off as a natural compound, started as something produced in nature, but then in the lab was manipulated. It may have been altered to make it more stable or to have a slightly stronger or slightly different activity than the original. These lab-altered versions of a natural substance are semi-synthetic. Synthetic chemicals, you may guess, are completely manufactured in the lab. They are sometimes completely new or novel and have never been isolated in nature. Or they may have found it in nature, but they synthesize it completely in a test tube without the help of any cells. It's possible that some scientists dreamed up the chemical because they were studying an enzyme that was crucial for a particular microbe, and they were looking for an inhibitor of that enzyme. These scientists may look at the active site and try different chemicals that potentially could bind the active site to prevent that enzyme from working. Antimicrobials are typically used to treat infectious diseases, but there are some other applications, like in agriculture. We're now going to move into evaluating different disinfectants and antiseptics in this last section of the chapter. The classic and sometimes considered the gold standard for evaluating disinfectants is comparing the activity of your test substance to phenol. Remember, we talked about phenol as being one of the first disinfectants that was ever used. Everything was and still is compared to phenol to relate how effective the disinfectant is. Basically, you compare dilutions of your test substance to dilutions of phenol and compare the effectiveness. If it's giving a value of 1, it's equal to the effectiveness of phenol. If it happens to get a number greater than 1, it's better than phenol. A number lower than 1, and it's less effective than phenol. This is really an old-fashioned method, and it's being replaced with more useful measures, but it's still used at times, and the coefficient number is reported for disinfectants, so it's worth understanding what it is. But now let's talk about some more common methods of evaluating disinfectants. The use dilution test is actually what the United States uses to evaluate disinfectants. To perform this test, little metal cylinders, imagine something that looks like a little pin, is used, these pins used for clothing. These little metal cylinders are dipped into a culture of bacteria. Then they take the cylinders out and they let the cylinders dry. They let the bacteria dry on those cylinders. That bacteria on the cylinders are some culture of interest. Maybe you want the disinfectant to kill Staphylococcus aureus. That causes MRSA. You coat your pins with the bacteria of interest, then you take those pins and put it in a dilution of your test substance. The dilutions represent the disinfectant at different strengths. You leave the cylinders with the bacteria coating in the disinfectant solutions for 10 minutes, and then you take the pins out. You rinse them with a little bit of water, and then you put them into a culture tube of media. You incubate and you see if anything grows. If nothing grows after a day or two, then that particular dilution of disinfectant killed them all. You only need one surviving cell to be transferred into the medium, and that will result in growth in the tube. This is an all or nothing result for your disinfectant dilutions. It kills them all in 10 minutes, or it doesn't. If after overnight incubation in the medium you see growth appear, then obviously you did not kill all of the bacteria. The most effective agent you're testing will prevent all the growth, even at a really high dilution for the disinfectant. If you diluted your test disinfectant out, so you had very little disinfectant present in the test tube, but you don't see growth after the incubation in the medium, then you know the substance is very effective. This is the used dilution test. It's the procedure used in the United States to evaluate disinfectant. So please work to be able to explain this procedure. In summary, step 1, take some little metal rods and coat them with bacteria of interest and let them dry. Step 2, stick the bacteria-coated rods in dilutions of disinfectant for 10 minutes. Let those disinfectant dilutions work on the bacteria for that time. Step 3, take the little rods of bacteria out of the disinfectant, rinse them off, and place them into media to see if anything grows. If something grows, you obviously did not kill all the bacteria. If nothing grows, then it looks like your disinfectant killed everything in 10 minutes. That's the used dilution test. The next test is called the Kelsey-Sykes capacity test. This is the method used in Europe. I'm a little partial to this particular test since it seems a little bit more useful. A little more information is provided by doing this particular test. In the top row, you have different concentrations of your disinfectant. It doesn't give a unit here, but let's just say this unit is micrograms per mil, which is a reasonable concentration. Notice you have very high concentrations over at the left. See the number 16? Then you have very low concentrations, 0.25 over on the left. You have different concentrations of your disinfectant from high to low, and you add a small volume of bacteria to all of them. These disinfectants are diluted into a medium, so you just incubate the bacteria and see whether the disinfectant inhibits the growth or not. If it doesn't inhibit the organisms, growth will occur the next day, as indicated by the little gray marks in those tubes. That's important. You now look for the lowest concentration where no growth observed. See this number 2? This is listed as MIC. This stands for minimal inhibitory concentration. The minimal inhibitory concentration is the lowest concentration of your disinfectant that prevents growth of your microorganisms. In this dilution, you can't know if everything is dead or just inhibited from dividing. The next step gives you more information. In the next step, you take all of the tubes where you did not see growth and you take a small amount of that liquid medium and add it to fresh medium. Now you have an extremely small amount of disinfectant transferred because you just transfer a very tiny bit of disinfectant and move it into the fresh medium. However, if there were surviving cells in that volume that you moved, they will now grow in the fresh medium. In this next step, you see that 2 of the concentrations actually did see growth after transfer, meaning the concentration of disinfectant in this step, in step 1, didn't actually kill the organisms, but it did inhibit their division and growth. At this third concentration, we did not see growth after transfer. The concentration is indicated by MBC. MBC stands for the minimal bactericidal concentration. The MBC indicates the lowest concentration tested where you killed all the organisms, not just inhibited them. This is a useful test, and this setup allows you to determine the MIC, the minimal inhibitory concentration, and the MBC, the minimal bactericidal concentration. You can't learn this from the used dilution test. Be sure that you can explain how to arrive at MIC and MBC. This next test is something similar to what you were doing when you were testing your environment for microorganisms. This is a test that people perform in industry when they're trying to validate their disinfectant procedures. Imagine a piece of equipment that is producing a product. Maybe it's a food, maybe it's a drug, maybe it's something else. But you don't want organisms building up on that particular piece of equipment because that could lead to contamination of your product. You have to have some sort of processes in place that will clean your instruments. The procedures will state to apply the disinfectant for a prescribed amount of time, that's predetermined to have been effective. But to verify the procedure is working as intended, what would happen is someone would go in and swab before the disinfecting procedure, then they would disinfect and swab again. Those swabs go into some sort of media that will allow organisms to grow. Then you wait and see if things grow. Obviously, if things are growing after your disinfecting procedure, you didn't disinfect well enough. You better go back and do something else. This test is trying to determine if your cleaning procedure is sufficiently effective. Once you've set up a cleaning process, you need to keep evaluating it to make sure it's actually doing what you want it to do. You need to verify you have clean instruments and equipment in order to make your product. This particular experiment is one we often do in the laboratory. It mimics what's going on in a clinical setting when somebody has some sort of infection. What a clinician would do is obtain the sample from a wound or a throat or somewhere an infection is occurring, and you swab samples across the entire surface. You must somehow inoculate the entire surface of the plate. It's called creating a lawn. A lawn is a solid confluent growth of your bacteria. Right after you inoculate the plate, you drop these little discs that you see that have antimicrobials impregnated within them. The antimicrobials diffuse out into the surrounding medium and you incubate. You then look for those zones of inhibition. When you see a large zone, like you see over there, that's a pretty good indication that the antimicrobial is effective. You actually would measure the diameter in millimeters and compare it to a table to see if it's large enough to be considered an effective therapy. If you see no zone, like here, where the organism's growing right up to the disc, that antimicrobial has no effect, and it's not going to be useful in trying to clear the infection. When you have smaller size zones, you need to measure them and look at the charts that come with the discs to tell you if it's large enough to be considered useful. The sizes of the zones indicate the organism is very susceptible, and it would be a good choice to use to clear the infection. An intermediate size means that the organism has some resistance and that it's not the best choice if you have some better choice. Intermediate zones are sort of iffy. You don't want to choose that antimicrobial if you can choose something that the organism is more sensitive to. The final category is resistant. Obviously, resistant organisms suffer no effect from that antimicrobial. This choice is not going to be effective in treating a patient with this infectious organism. This testing procedure is known as the Kirby-Bauer for the scientists that developed the testing method, or otherwise it's a disc diffusion test. We'll be doing something like that in the laboratory. Finishing off this section with a thought. There's really no good evidence that it's helpful to use antiseptic or disinfecting agents often in our everyday lives. We don't really need all of that for our normal situations, because when you use those products, you're really promoting the development of resistant microbes. That's how evolution works. We don't really want to have a bunch of resistant microbes in our environment because when we need to be able to kill off them under specific circumstances, we want to be able to. Resistant organisms will make it more difficult to do so. This figure is illustrating that idea with antimicrobials, but you can insert any method of chemical control with specific cellular targets and see the same effect. If you have a population of organisms, there's always some variability in that population. Random mutations happen and are a part of the genetic makeup of the population. In this image, among the dots representing bacteria, they show a couple of red dots. These indicate naturally more resistant bacteria. When you apply that particular antimicrobial agent, you don't kill everything. The resistant bacteria are capable of surviving, and then they're what multiply and dominate the population. This is what we have seen with antibiotic resistance, which is a serious issue in the medical field. We're running out of effective options for some types of infections because resistance has developed in these populations. You can apply the same principle to other types of chemical agents. Our best option is when we can use a chemical agent, we want to ensure that it has broad activity and it affects many targets within the cell. When there are a lot of targets within a cell, it's not as easy for the cell to develop naturally resistance. A bit more on resistance when we get to chapter 10 on antimicrobials. But happy day, we've come to the end of chapter 9. Until next time.